that each of these brings. So you would find that when it comes to community-based participatory research, we've got the communities themselves who are bringing in lived experiences. Then, of course, there will be the academics or the public health students that will be bringing in the technical expertise, the phrasing, or the technical jargon that is associated with the research space. And all of those things, they are very key. And one of the key things that we need to look at is, why is this community-based participatory research so important? One of the part of this is around getting to have a community-led initiatives. So as we do our day-to-day activities, we need to keep it in mind that communities need to be at the center stage of the work that we do. In as much as we do our master's or our PhD work, we need to keep it in mind that at the end of it all, we want to do something that will drive change in our locality. We want to do something that will drive impact in our communities that we serve. So it is very, very key that when we do work in the communities, we come up with something that is practical, that is tangible, but we do it with the communities taking a lead, because they need to guide our research topics. They need to guide how we craft the studies that we need to undertake within those particular communities, so that we don't parachute, we don't bring in studies that are not even relevant to the communities that we serve. And then the other part is around strengthen community ownership. So you find that when you do your studies and they have the communities actively participating in that particular study, when that study has been conducted, there is community ownership. The communities would feel like they can adopt the practices. That is why you find that some of the studies that get to be undertaken, they don't translate to practical changes on the ground. Hence, it is key for us as researchers to undertake studies that will translate to something that is practical, a practical change that happens on the ground. And then community-driven research also drives the part of practical implementation, to say that at the end of the day, you would find that you would want your study to be driven by the community, but over and above that, to be relevant to the communities that we are serving. And also, through this particular approach, you will find that we adopt a much more inclusive approach, where we can get to involve people with disability, we get to involve men, we get to involve women, and we promote equity through this particular process. Hence, it is very key for us to undertake community-based participatory research. So you will find that there has been a transition from traditional forms of research to current community-based participatory research. And one of these things is that in the olden days, we used to have community consultations, where we would be having gatherings of community for feedback and all that. And then it transitioned to actually having community involvement, where there is active participation of the communities in our studies. But also, it has since transitioned to a much more collaborative effort. You would find that even when it comes to the crafting of the studies, there is a much more collaborative approach that gets to be undertaken when we are coming up with those particular studies. For example, in the South African context, we've got civil society forum, and there are different sectors in there. Like we've got the PL-HIV, the people living with HIV sector, we've got the sex worker sector, we've got the women's sector, the men's sector. So there are about 18 sectors. And each of these 18 sectors, when they are undertaking studies, or when academics are undertaking studies, they come through, they reach out to these particular sectors so that they work collaboratively with them. But one of the phases that is key when it comes to community-based participatory research, it's around the statement that says that nothing about us without us, where we talk about shared leadership, from conceptualization to data collection, to data analysis, to actual reporting, report dissemination, and advocacy work that is associated with those particular studies. The communities need to be part and parcel of that particular process. And these elements, they are key when it comes to crafting of our research studies and making sure that they are relevant to the communities that we serve. And then there is an aspect to do with what this is. So community-based participatory research is actually an orientation and not a method of doing things. This approach emphasizes the importance of starting with a research topic that holds significance to the community. And also it aims to combine knowledge, action, to drive social change, improve health outcomes, and eliminate health disparities. So it's not so much about it being a method of doing things, but a lot more to do with a combination of methods or approaches where at the end of the day, the end goal is to combine knowledge and action to something that will drive practical changes at a grassroots level, that will translate to practical changes when it comes to improving access to health services, improving health outcomes, driving change in our locality. So part of the principles of community-based participatory research is around a co-creation of knowledge. So you find that key in this work is that knowledge needs to be co-created. We need to work together with the communities to co-create knowledge in the work that we do. There is equitable partnership. I think I've hit on this to say that we are bringing in the communities. The communities are working collaboratively with us. We are equal partners in terms of contribution, in terms of the discussions, in terms of the analysis of the data. We might be having different strengths, but we are equal partners. Then the other part is around action-oriented research. So it's more about driving change in our locality. It's a lot more to do with driving a change within the respective communities that we serve. And then also there is mutual learning and capacity building. You would find that as we go into these communities, we're in a position to learn new and unique things about those particular communities. So the communities are also in a position to learn about certain ethical principles. They're also in a position to learn about certain technical jargon that we use in the research space. And all of these aspects, they are key because we get to learn from each other. We get to benefit from each other's interactions in this particular process. And then, of course, the theoretical foundation of community-based participatory research, this centers around these three pillars from where I'm sitting. It's largely aspects to do with, there is participatory action research, where we are expecting all the stakeholders to make it a point that they come through based on their areas of expertise. They come through and make input into the process, into how things get to be done when it comes to practical implementation. And they are all equal partners. But also over and above that, we talk about the social determinants of health. To say that there's all of these social determinants of health that need to be taken into consideration when we undertake these particular studies. Because we are working in these communities. We are not working in a vacuum. So let's keep in mind, there are these social determinants of health that come to play as we come up with these studies. And then the other part is around the human element, where we talk about the human-centered design. To say that let's have a people-centered approach. Let's have a community-centered approach. Let's have a community-driven initiative that drives localized change. And these are some of the theoretical foundations that tend to play a role in how we do our work. So, I'm going to touch a bit around some of the steps and processes that you get to be involved in when we talk about community-based participatory research. It's around the initial engagements where we're identifying and engaging the communities. And this happens when we are trying to get the buy-in, to say who would want to undertake a study. Is the broad area of this study is going to be around, say maybe uptake of PrEP, is going to be around climate change, or is going to be around, let's say, TB. And then we will go on to say that let's co-create, let's develop the questions, let's come up with what angle are we going to be looking at. So collaboratively with the communities, we begin to talk about what will be the angle, what will be the study that we want to undertake. Because we want to make it a point that that community that we are going to be doing the study with adopts the changes that we will have come up with at the end, because they see relevance in the work that they are doing. And then from there we move on to the actual collection of data. After the data collection, we've got the analysis of data, where you would find that in most cases, community members might not have high-level technical expertise when it comes to aspects to do with statistical softwares, qualitative data analysis softwares. So they might not be having that kind of strength, and then we bring in those expertise. And then the other parts around the translation of findings. Now, at this particular stage, when we're now translating findings, communities play a key role. In as much as the stats has been analyzed, it needs to be presented back to the communities so that they can begin to contextualize, to give us some context, and it translates to us having actionable insights at the end. Because it is very key that as researchers, we come up with projects that translates to actionable insights at the end of it all. And then I must say that when it comes to the comparison between traditional research and this community-based participatory research, you would find that with community-based participatory research, it's more collaborative in data gathering, shared decision-making, and also social change. While, on the other hand, traditional research is more extractive in nature. It's about gathering information from the communities. It's more of a researcher-driven initiative, and it's researcher-driven decision-making that comes out. Yet, the value cannot be overemphasized. We derive more value if we adopt a much more collaborative approach. Hence, it is key for us to do community-based participatory research. And then, some of the challenges that we are foreseeing, it's around power dynamics, where you find that there are always these potholes of power, where researchers will go into the communities, they feel like they know. Where communities, they feel like you are coming to extract, you are using them. So, it is very important that we clarify all of those dynamics and we reach a consensus. The other problem is around informed consent. In some cases, the researchers, they go into these communities and they don't seek appropriate consent and permission to undertake these studies. Then the other part is around sustainability, where it is key that as we implement our programs, we keep sustainability at the back of our minds to say that what is going to happen in the long term? Is this something that can be sustained in the long term? So which means that as we build capacity in our communities, we think about the sustainability element to say it works to our advantage as researchers if we build capacity in the communities, because in that way, even post-program implementation, even post the research study, we have built researchers that are based in the communities that are in a position to be a resource for our next study. And they might even propose new and fresh studies for us to undertake. With that being said, it brings me to the end of my talk around community-based participatory research. I would like to echo the sentiments that it is very key and critical that as community-based organizations, as researchers, as people that were born and bred in different communities, we come up with studies that are relevant and tailored to our communities that are going to drive localized change, not just for academic purposes, but for purposes of driving change in our locality. And thank you for this opportunity once again to come talk about community-based participatory research. Thank you.